Why would someone have an MRI that shows holes all in their brain? Happy New Year, and for this Sunday case study, I'm going to bring you a case that's going to make you go, holy moly. I have a 28-year-old male who presents to my office with headaches. His primary care doctor ordered an MRI that showed this. What in the world are we looking at with all of these holes in this man's brain? His past medical history is really insignificant. He doesn't really have any known medical problems, but he did recently move here from South America. What in the Grey's Anatomy is going on with this MRI, and what can we do about it? Stay tuned tomorrow and I'll go through the whole case. What can cause holes in your brain? Yesterday, I presented the case of a 28-year-old male that came to my office with headaches. He's had these headaches for a while, but they've gotten progressively worse. He had no significant past medical history other than the fact that he grew up in South America and recently immigrated to the United States. MRI of his brain was ordered by his primary care doctor that showed all of these spots on his brain. Have you ever heard of brain worms? Well, now you have. Many of you guys got the answer to this, and this is neurocysticercosis, which is a parasitic infection to the brain, or brain worms. How can that happen? Here's a brief explanation. You first have the pork tapeworm named Taenia solium. Then a human eats undercooked or raw pork and gets the tapeworm in their intestines. That person then passes these tapeworms in their feces. If they don't wash their hands properly, the eggs can get on their hands and then they contaminate food that can be ingested by another person. When this person eats the eggs, then they form into larvae within the body and can go to the brain. Then you get brain worms. Most people in the United States that get neurocysticercosis come from regions in which the disease is most prominent, including Latin America. The time interval from getting the infection to developing symptoms within the brain can be anywhere from 1 to 30 years. Cysts in the brain can cause a variety of symptoms such as headaches, seizures, altered mental status, and even hydrocephalus. The first stage, you can actually have active parasites within the brain. In 4 to 5 years with no treatment, or in the early stages of treatment, the membrane surrounding the cyst can become leaky and you can actually get swelling around the cyst, and this can cause neurological deficits. Over time, the cyst will eventually involute and then you get these calcified nodules within the brain. In disseminated cases like the case I presented, you can see all of these larvae within the brain that have involuted over time. Once diagnosed, anti-parasitic medications is used to treat this infection. Most cases of neurocysticercosis do not need surgery, but sometimes we do need to take a biopsy to make the diagnosis, and sometimes a patient needs shunting if they develop hydrocephalus. That means that these larvae can actually obstruct the fluid flow within the brain. It's the leading cause of adult onset epilepsy worldwide. So how can we prevent this problem? Good hand washing hygiene and treating patients with active intestinal tapeworms can drastically reduce the number of new cases per year. Hope you guys learned something today, and stay tuned next week and I'll go through another interesting case. I hope you have a wonderful start to your 2023.